right. Well, in this sponsored segment, we're going to be talking about that exciting time of the year, back to school. All the kids are usually excited about it, but you know, there's some things this year that have happened. We want to talk about some mental health issues. So Dr. Ben Llewellyn is joining me here. We're at Tanner Clinic. And Dr. Llewellyn, like what is the scope of what we're dealing with as far as mental health of kids going back to school?
Yeah, that's a great question. Kids don't know how to express how they feel. And so parents and educators and doctors even don't know even to ask about it. The problem with mental health is big in kids. About 1 in 6 children this year will have depression. That's from age 6 to 17.
Is that just normally true, or is that true because of the kind of year that we've had?
That's normally true.
Okay.
Experts are thinking that it will be more this year, but we don't know.
And when you say kids don't know how to talk about it, are you talking about really young kids or just kids in general? Like we always need to be checking in with them. Is that what you're saying?
Yeah. This is something that is scary for people to talk about. And you can imagine if you don't know how to express how you feel, it can be even scarier.
So what are some of the symptoms we might spot?
So for an adult, we talk about depression as being, I feel depressed. And maybe if I told that to you, you would know how I felt. Kids, though, they don't know that depression is a thing. So things that parents and educators can look out for are things like withdrawing. So if a kid is previously very social or active and they stop being so, that can be something to look for. Other things could include personality changes, irritability. So if your kid is anxious and irritable, if they seem really scared, despite you reassuring them, those can all be signs of a mental illness.
So they know something's not quite right, they just don't know how to express it or what it actually is manifesting in them. Okay, so good signs to be watching out for. Who should be part of the child's support team, would you say?
I think that starts at home. So your parents have to be engaged. Parents can't dismiss it or say, "I'll snap out of it," or "You'll get over it."
Yeah.
But then there's a lot of resources at school, starting with your teacher. Teachers are an integral part. They can be the reporter of how a kid does at school. Schools often have counselors available or school psychologists that can be brought in to help kids who are struggling with their mental health.
What if you are one of those parents who says, just deal with it, or just snap out of it, or stop acting that way? I mean, does it affect them long term, or does it help kids be more resilient?
I would say that if it's going on and not getting better, it can be pretty damaging, because you're essentially telling your child that what they're feeling isn't valid.
Okay. All right. COVID. We got to talk about COVID. The increased anxiety and stress of going back to school and all the mandates and that sort of thing. Help us out there.
So if you think about it, this is the 3rd school year now that's been affected by COVID.
Right.
Starting in the spring of
That
2020.
is depressing.
Right?
Yeah.
And kids, they hear it all on the news, and they're certainly talking about it, and it can be very scary. The things that you can do as an adult or as a parent is to be constant. Kids do best when things are the same.
Okay.
If you think about your kids or my kids, schedules with school are always so good because everyone's in the same schedule and things are the same.
Yeah.
COVID has the ability to disrupt that. So do everything you can to keep things the same, or I don't know, normal's not the right word, but
Some consistency.
Consistent, yes.
Okay. And then quickly, treatments.
So treatments, therapy and medicine are the treatments for mental health. If I were to have my children need mental health help, I would start with therapy. Having a neutral third party for them to talk to is a good idea.
Okay. All right, Dr. Llewellyn, thanks so much for joining us for this sponsored segment. And if you'd like to know more, go to abc4.com/GTU. We'll have your information there on the screen for Tanner Clinic. Thanks so much.
Thanks, Janine. Keep it right here. We share the benefits of walking in nature next.